February is National Cancer Prevention Month, and I'm very happy to have met for the first time just a few minutes ago here in Studio 61 Dr. Karishma Mehra, the Director of Cancer Genetics and Prevention at Trinity Health of New England. We need to talk about what we can do to prevent getting certain cancers in the first place. And there are so many different cancers, but there's a lot of good general guidelines. A pleasure to meet you. Thank you for taking the time to join us today.
Thank you for having me, Tim.
Yeah, glad to have you here. We were talking a couple minutes ago. You said sort of it's a two-pronged approach to trying to prevent cancer. So why don't we take it one prong at a time? And what is the first sort of most important tenet here?
I think the first thing would be, how do we prevent cancer? And a large number of cancers are caused from our lifestyle. And so we can make small lifestyle changes, live a more active lifestyle, try to prevent sitting around a lot. You know, take the stairs when you go to work, or take a walk during lunchtime.
Yeah.
You know, eat a healthier diet, have a more plant-based diet. You know, try to avoid more the red meat and the high sugar drinks. You know, not smoking. Of course, limiting your alcohol. You know, wearing sunscreen, things like that, where you can do things to prevent developing cancer.
Just how much of a difference does that make? I know it's hard to sort of put these things into numbers, but I mean, is it just a small part of the overall problem and genetics are a big part of it, or is it the other way around, or somewhere in the middle?
No, I think it's a very important thing, and there's small things we can do, but about 40% of all cancers can be attributable to lifestyle. So I think making these changes can really help decrease your risk. We know that we've known now for a long time the relationship between smoking and lung cancer.
Yes.
So those lifestyle changes are important.
Yeah, and of course, sun exposure, ultraviolet light exposure, and skin cancers. These are and then the red meat, the processed meats, cooked red meats. That's a big one too. But I feel like obesity and sedentary lifestyle, that has prongs to so many different cancers that are not immediately obvious. I can't think of any at the top of my mind, but you report on these things enough time after time. How big of a factor is just controlling your weight?
Such an important thing. I talk to my patients all the time. You know, breast cancer has very strong links to obesity. So does uterus cancer, prostate cancer. You know, having, you know, I think programs where we encourage activity in children and adults, whether it's group-based or kind of more taking your personal time to get that walk in.
Right.
Very, very important. You know, trying to decrease the amount of time we spend in front of a screen, you know, to get active.
Bad news for me. So the second prong here is screenings. And obviously that must vary from cancer to cancer.
Correct.
But why don't you talk about that a little bit, Doctor?
You know, cancer screening is so important because as much as we change our lifestyle to prevent cancer, I think preventing late diagnosis of cancer is very important. When we diagnose it early, it is our best chance of cure. So whether it's mammograms for breast cancer, or colonoscopies for colon cancer screening, pap smears for cervical cancer, lung cancer screening for smokers with CT scans.
Okay, didn't know about that.
Yes,
there you go.